Bismillahirrahmanirrahim. Today, the topic of our presentation is National Health Card. First, we are going to introduce what is National Health Card and why it's essential for the nation and society welfare. First, we are going to introduce health policy generally describe fundamental principle regarding which health providers are expected to make valuable decisions. Health policy providers framework of the CN for guiding health actions that are useful to its community in improving their health, reducing the gap between the health status of have, ultimate contribute to the quality of life. NHP 1983 stressed the needing for providing primary health care with special emphasis on prevention, promotion, and rehabilitation. Next is the priorities of this policy. Number one is nutrition, prevention of health, adulteration, and quality of drugs. Third is water supply and sanitation. Fourth, environmental protection. Fifth, immunization programs. Sixth, maternal and child health service. Next one is aspects of this card: health education, development of managerial information system, production of drugs and equipment, health insurance and legislation, med- medical research, policy formulation. Next is opportunity statement. Qawmi Sehat Card, National Health Card is a micro health insurance initiative currently available for citizens of Khyber Pakhtunkhwa, Punjab, Balochistan, Gilgit-Baltistan, Azad Kashmir, Islamabad, Helpather under the Sehat Sahulat program by the government of Pakistan. The low-income household Punjab government has launched healthcare known as Qawmi Sehat Card to provide healthcare services for low to underprivileged. Next is what is the goal of National Health Card? The goal is the coverage would be expected up to Rs 1 million under special circumstances. The beneficiary can go to any implant hospital across the country. No capping on family size. Coverage on yearly basis to all age group. Sehat Sahulat program will cover priority therapy care package and secondary care package. There are two packages in this. First one is secondary and primary package. And next we are going to discuss about the topic about objectives of this National Health Card. Many of the key stakeholders are therefore unfamiliar with health insurance mechanism. Our final objective of the study was to create an open dialogue about the membership profile and claim experience at a scientific session of the Health Service Academy 90th Annual Public Health Conference in Islamabad on 4th December 1918, providing free of cost hospitalization, emergency service, inpatient service, fractures, injuries, referral transportation, maternity service, and free follow-ups. Next one is success criteria of National Health Card. The priority package of PM Health Program also covers diabetes, cardiovascular disease, burn, organ failure, road traffic accident, oncology, neurosurgical procedure, advanced renal diseases, dialysis, and chronic diseases such as TB and hepatitis, among others. Health care to any poor is the provision of free health care for any kind of disease in private public hospital. It will not only alleviate poverty but will provide financial health protection against catastrophic health and expenditure, and people will more willing to contribute the best toward the economic development of the economy of Pakistan. Exclusive packages. Exclusive list for the secondary healthcare policy shall include costs resulting from self-inflicted injury, attempt suicide, abuse of alcohol or drug addiction, psychotic, mental or nervous disorder, or sexual reassignment. Third is treatment or investigation of fertility, infertility, sterilization, or contraception, and any complication relating thereto, or hormone treatment and investigation. For further, I would invite Ahmad Hassan to come and proceed.
Assalamu alaikum. So I will continue from the next slide. Uh, that what are the responsibilities of National Health Card? That ensures progress and patience of the hospital staff during the treatment. They should understand about the program and especially what is not covered in the program. Should read the program flyer and brochures and all the advertisement that are beneficial for the level of awareness about the program and given that what inside this program. Then we should call to helpline given numbers to on the card for inquiring and helping people to deal with the issues related with the National Health Card. So in the next slide, there is a cost analysis of National Health Card, some benefit packages like disease treatment package and coverage of package initial. We can see that we have listed the initial coverage for around about 300,000 families per year. That covers around 60,000 families per year. Additional charges are only posted if required about 300,000 families per year. Additional charges that would be 60,000 family per year diseases. That are the all diseases covered in this package. So in the next slide, there are some of the benefit riders like all emergencies covered up to the 4 antenatal and 1 postnatal checkup and provisions of 1 long-term contraception if agreed by family. One free follow-up post admission that will provide transportation cost of around 1,000 per discharge from hospital, and that would be about 3 times per year. In the next slide, there is some. In the next slide, there is a there is a Gantt chart of our project, our community health card. That in the first activity there is NADRA verification and data collection that last for 7 weeks, and the second one is identification of card policy, coding and decoding, and so on. There is online portal and verification, identification card conversion to health card, and there is a hospital appraisal. These all include a process of 7 to 8 weeks. Then is a Gantt chart diagram that we can see by including some precedents. There is our team, NADRA team, then census team, IT department, and then NADRA. Then comes public health sector, government health sector, social marketing, health insurance departments, the whole cell, advertisements, and HR department, and PM or potential financial development. That then comes some of the diseases that have been covered by the most vital diseases that have been and chronic disease that have been covered by the program, the diabetic mellitus and burns and LTA, the end-stage kidney diseases and their dialysis, chronic infection, hepatitis and HIV, organic failure, liver, kidney, heart, lungs, and cancer. And that includes chemo, radio, and surgery. So in the process of crashing, we can see that how we can crash. That we see that the normal days and the normal cost. Then comes the crash cost that would be the less cost than the actual cost in reducing the time. Uh, Due to this diagram, we can see that there is first Nadra census team. That is basically a critical part of our project. Then that comes in the line in the queue of the whole processes of IT department, NADRA, public health sector, government alliances, and all other. Then comes the risk register at the last. Lack of people awareness. There are the more important risk factors in our program that why our Pakistan lacks in the completion of any process due to these risks. Include lack of people awareness, fraudulent activities, mismanagement in process, misleading the process, accepting late request, low economic budget, large number of people applications. So, in the conclusion, there is public health. I can conclude that the public health is very vital function, and that requires that a public board concern and support in order to fulfill society's interest in assuring the conditions in which people can be healthy. History teaches us that the organized country effort is prevent disease and promote health in both home area and must lend professional knowledge with community values and the public awareness is the best way of the recurring for your people health, but to the urge that the leaders get involved in their own communities in order to address present dangers now for the sake of the future generations. So that was all from our part. Thank you and Allah Hafiz.